So what is the microbiome? The microorganisms in a particular environment, including the body or a part of the body. We depend on a vast army of microbes to stay alive. A microbiome that protects us against germs, breaks down food to release energy, and produces vitamins. So how do we establish the microbiota? Babies are colonized in the first few days of life by the microbes they encounter during delivery and through early interactions with their environment. An infant is greatly influenced by whether the baby is born by cesarean section or vaginal delivery, as well as if the baby is breastfed or formula fed. In clinicals, when I went to clinicals, we were actually trained to handle the babies as little as possible. So nurses in the labor and delivery unit are trained to handle a newborn as little as possible in order to avoid disrupting the family flora. We are taught to encourage the mother to hold the baby with skin-to-skin contact and begin breastfeeding as soon as possible after delivery. So what can disrupt our microbiota? Several things can disrupt the microbiota in our bodies, lifestyle, diet, hygiene, but one of the most common disruptions to normal microbiota is antibiotic therapy, which kills many types of benign resident bacteria along with the pathogen that's being targeted. Overprescription of antibiotics has been an issue in the past, and we are taught to educate patients on the conditions that need antibiotic treatment versus those that do not need it. That would be viral infections, or sometimes children will just get over, ear infections without the use of the antibiotic. There are a lot of pushy patients that really, really want them, but educating them usually helps. Antibiotics are also found in the food that we eat. This is because antibiotics are added to animal feed or drinking water of cattle, hogs, poultry, and other food-producing animals to help them gain weight faster or use less food to gain weight. This also encourages antibiotic resistance, so not only are we being exposed to it, but it's also creating resistance. Restoring. How disruptions in normal microbiota can lead to infections and disease. The microbiota functions in tandem with the host defenses and the immune system to protect against pathogen colonization and invasion. With normal microbiota reduced, opportunistic pathogens are able to establish infections. A common example would be when a woman takes antibiotics to treat a UTI only to develop a yeast infection afterwards. Restoring the microbiota. Therapeutically, probiotic-based approaches have been used with some success, as have the more drastic approach of wholesale microbiota replacement strategies based upon fecal transplantation. Fecal microbiota transplantation is considered to be highly successful therapy for recurrent and refractory C. diff infection, and that's based on recent clinical trials, but this was from 2014.